Hello, this is Dr. Brett Taylor. Today's case, we're going to discuss an individual who had prior surgeries and ultimately had a motor vehicle collision. I determined that based on a reasonable degree of medical certainty, the motor vehicle collision resulted in a permanent aggravation of her pre-existing lumbar condition. Her past history was notable for a previous microdiscectomy and ultimately an L3-4 fusion with a posterior instrumented fusion and TLIF procedure. On presentation, we determined that she had failed back syndrome and chronic lumbar radiculopathy. Her imaging studies revealed multiple findings, including a failed fusion at her prior surgical level, and the interbody device that was performed during the TLIF procedure had sunk into the bone. The medical term for this is subsidence, where the device sinks down into the bone. It results from a number of issues, including a mismatch between the stiffness of the device and the bone quality. As well, there can be some inflammatory changes around the device that results in loss of bone and sinking of the device. She also had adjacent segment disease with compression of the nerves at the L4-5 level. The lower level, L5-S1, also was a source of her pain identified with diagnostic injections. We chose to provide her a revision surgery through an anterior approach. With this type of surgery, the long-lasting improvement can be provided by restoring the natural alignment of the spine. This is done by increasing lumbar lordosis. Providing a more natural spinal alignment provides meaningful improvement in back and leg pain. As well, using an anterior lumbar surgery to revise the failed TLIF offers a very high fusion success rate. All of these surgeries can be performed anteriorly, avoiding muscle stripping, which is associated with increased back pain. We were successfully able to, through an anterior approach, remove the prior TLIF fusion device and extend her fusion from L3 to S1. Even though it was discussed that there may be a requirement for a delayed stage posterior surgery, this was not required, and she resulted in a solid osseous union after the anterior surgery, and this was confirmed with postoperative advanced imaging. Thank you very much for listening. I hope you found this informative. If you have additional questions, please reach out to my office.